everyone. Thanks for tuning in today to receive some tips on how to protect yourself from 3 different types of cancer. And we have Hannah Farley here from the Cancer Services Program of the Finger Lakes region. Hannah is their outreach coordinator, and she's super excited to be here today to share these tips with you that can help you to protect yourself from cancer. So Hannah, I'm going to let you take it over. Please tell us.
Goodness,
everything you know.
Everything I know. Oh goodness, we'd be here for I don't know how long. Yeah, thanks Stacy, and thank you to the Masson Library for hosting this. And so, yeah, my name's Hannah. I do a lot of the outreach for the Cancer Services Program of the Finger Lakes region. I'm mostly in Wayne, Ontario, Yates, and Seneca counties, but we cover a larger region. We also cover Monroe and Livingston counties. And what we are, the Cancer Services Program, is a New York State Department of Health program that pays for breast, cervical, and colon cancer screenings for uninsured New York State residents who meet some certain age and eligibility guidelines. And so the Cancer Services Program of the Finger Lakes region is based out of the University of Rochester Center for Community Health and Prevention. But I'm joining you today from Thompson Hospital in Canandaigua, which is where my office is located, because we cover we cover 6 counties. So we like to be a little everywhere. Oops, let me just do that. So to start with, hi, welcome. To start with, before we really get into depth about breast, cervical, and colon cancer screenings and ways to reduce our overall risk, I want to give you a little background about myself and a short story about cancer. So when I was in my mid-20s, I received a call from my mom she was experiencing chest pain when she needed to drive to the hospital. We were in Monroe County at the time, so I got her into Strong Hospital's emergency department, and we were there for maybe 10 hours. Emergency department time, hospital time is a little different than normal time. And we found out after some chest x-rays and some other tests that she had about a football-sized tumor pressing up into her chest. And she was eventually diagnosed with stage 4 cancer. And unfortunately, she did pass away in 2018 from complications with this disease. And the cancer that she had was kidney cancer. So not one of the cancers that we're going to be talking about today. And this kidney cancer isn't really a very common cancer, and we really don't have a cancer screening for kidney cancer. But we do have screenings for our breast, colon, and cervical cancers, which those are the ones that we're really going to be focusing on today. But I will offer some other kind of tips on how you can help to reduce your overall risk for other cancers as well. So here, I'm going to just click to the next slide. I hope you can see it. Stacy, we can all see the slides, right?
Yes, I can see it.
Okay, Diane, I hope you can too. So, before we really dive into the different screenings and risks, I just want to take a moment to talk about COVID-19 and cancer screenings. It's, we're still in the pandemic, and a lot of people put off their cancer screenings because of the COVID-19 pandemic. And the thing is that cancer screenings, they can and they do save lives. And so it is so important that if you did delay your cancer screening last year, like so many of us, it's so important to get that back on the schedule. Call your doctor. If you're hesitant, if you're nervous, ask the office, what are you doing? Are you wiping down the rooms in between patients? They don't mind answering that. They might answer that all day. And most of them are vaccinated, if that's a concern of yours. And so these screenings, they are being done safely. So definitely give your doctor's office a call if you haven't already, and get your screenings back on the calendar. A lot of them, we're all following those COVID-19 guidelines. I can't walk into my office without getting screened for COVID-19. And so what our program what we can help you do is the Cancer Services Program helps you to get screened, even if you don't have insurance. So maybe that's one of your barriers. Maybe you're uninsured. Maybe you think you can't afford a cancer screening. Well, we exist to make it so that you can, in fact, get your screening at no cost. So did you know, just a couple quick facts, cancer is the second leading cause of death among New Yorkers. I like to ask, does anyone want to guess the first? But I'll answer that for you. If you didn't know, heart disease is still the leading cause of death among New Yorkers, but cancer really isn't far behind. In cancer screenings, they can, and they do save lives. And screening with a mammogram, because remember, we're talking about breast, cervical, and colon cancer today. Screening with a mammogram can actually help to find breast cancer early when treatment might hopefully be more effective. And then cervical cancer and colon cancer screenings can actually prevent cervical and colon cancer from developing when they're performed regularly, when you're up to date. So we're going to be talking about that. So what cancer is a condition where abnormal cells just grow out of control. And these abnormal cells can form masses. Often, you'll hear that word tumor. And so a common question that people have is, well, what causes cancer? Wouldn't that be great to know about, what causes every different type of cancer? And so there are over 100 different kinds of cancers, which, means there might just be as many different types of causes of these different cancers. And so while doctors may not fully understand exactly what causes each cancer, there are some things that we can do to increase our chance, some things that we know that can increase our chance of cancer developing. And these things are known as risk factors. And so this just shows you a couple of the risk factors. Being age, as we get older, a lot of the time our risks for certain cancers does increase. Our race, so depending on your race, you might have a higher or a lower risk for certain cancers. And then family history. In family history, we're referring to a close relative, like a parent, a sibling, someone, a first degree relative. You'll often hear that term. And so these risk factors, things like getting older and your race and your family history and your genetics, these things can't be controlled. And also, even if you have these risk factors, that doesn't mean that you're going to get cancer. If you don't have any of these risk factors, doesn't mean that you're not going to get cancer, right? So, however, well, the good news is that a healthy lifestyle too can help to prevent certain cancers, which we're going to talk more in detail about. And also it's important to see your doctor for these regular checkups and to get your screenings, eat healthy foods, regularly exercise. We're going over it all. And again, I keep coming back to screenings. These regular cancer screenings, they can save lives. And a screening means checking for cancer before there are symptoms or any problems, before you feel a lump, before, you start experiencing like abdominal issues. So before there are symptoms, that's what we want you, when we want you to get screened. And so we're going to be talking about the breast, cervical, and colorectal or colon cancer. I'm going to use those terms interchangeably. And I'm going to start with breast cancer. And it's a very, very common kind of cancer in women. About 1 in 8 women will be diagnosed with breast cancer in their lifetimes. And what we're seeing is that actually more and more women are being diagnosed with breast cancer, but more women are surviving it. So, or, less women are dying from it because they're getting screened. They're getting these regular screenings so that you're able to find it when it's more treatable. So what is breast cancer? Well, it's cancer that starts in the breast. And breast cancer can spread to other parts of the body. And women younger than 50 can get breast cancer, but most often it's found in women who are 50 and older. So some of the risk factors, well, being a woman, it kind of goes without saying, but men can get breast cancer as well. But the biggest risk factor for breast cancer is really being a woman. Also, getting older, as I mentioned, most breast cancer cases are diagnosed in women 50 and older. Also, having had if you've had breast cancer before, or if you've had some type of non-cancerous breast disease, that could increase your risk for breast cancer. Having a first-degree relative, mother, sister, father, daughter with breast cancer, especially if they're diagnosed at an earlier age. And then if you've had genetic testing and you found out that you've had genetic mutations such as the BRCA1 or BRCA2 genetic mutation, that can increase your risk for breast cancer as well. So if any of these apply to you, you might want to get screened earlier, or speak with your doctor about the different screening options. These are some more risk factors. So if you've never given birth, or if you gave birth but you didn't breastfeed, or if you gave birth to your first child after 30, that can increase your risk for breast cancer because certain hormonal factors do play a role in your breast cancer risk. Also, if you had your first period starting younger than 12 years old, or you started menopause at a later age, that can increase your risk for breast cancer. And then if you've used long-term use of hormone replacement therapy. And then, well, there's a couple other risk factors. So like if you consume alcohol, we'll get into this a little bit more. Consuming alcohol, any amount of alcohol, any type of alcohol increases your risk for breast cancer as well as some other cancers. Not getting enough exercise, and also exposure to radiation of the chest, like if you had a chest x-ray early in life, like in your teenage years or younger. This is an additional risk factor I want to talk about dense breast tissue for just a little bit. It's a term that I think is becoming a little more common. Now we know what dense breast tissue is, I think most of us. So after your first mammogram, or second, third, whenever, your doctor might let you know that you have dense breasts or you have dense breast tissue. And this is very, very common. Dense breast just means that you have less fatty tissue, what happens is it can just make it harder for the radiologist to look at those images of your mammogram and look for signs of cancer, look for tumors or anything like that, because that dense breast tissue on the mammograms, it shows up as like kind of cloudy looking, like whiter tissue. And it just makes it really quite a bit more difficult for someone to look at those images and see, is that a tumor or is that just, part of your breast? And so women with dense breast should talk with their healthcare providers about their other risk factors and see if other risk factors for breast cancer, and decide if more screening tests are needed. So that's a conversation that if you know that you have dense breasts, talk with your doctor and see what other options there are for you, because having dense breasts doesn't mean that you are more likely to get breast cancer. It just means that it's harder for the doctors to see it in the screening. So all women can get breast cancer regardless of their risk factors. You can have one or more of these risk factors, not get it. You can have no risk factors and get it. And so the breast cancer screenings are so important for all women, regardless of any of your risk factors. And so this is just a mammogram. This is an image of a mammogram. You hear there's 2D mammograms, there's 3D mammograms. Most of the places around Finger Lakes region, they have 3D mammograms. That just means they're taking more images of the breast, more stuff for the radiologist to look at. So this is just an example. And so a mammogram, it's essentially an x-ray of the breast. You can see here that you see like fatty tissue, you see some more like that more dense tissue. And so this is really mammograms are the best way to detect breast cancer at this time. So there's also clinical breast exams, and that's when your doctor will use his hands to feel for any lumps or abnormalities, any changes to the breast or in the underarm. But really, whether a woman has a clinical breast exam or not, it's still important to get those regular mammograms. And there's also self-breast examinations, and those alone are not efficient at detecting breast cancer. However, it is good to know the look and the feel of your breast and be able to recognize any changes. And then you can bring those concerns, these concerns about any breast changes to your doctor, and you can talk about them, because you are the first line of defense for your body. So just be aware of any changes, be aware of how you're feeling, and let your doctor know if there's something that you find concerning. So quickly about mammograms, mammograms can find signs of cancer before there are symptoms or problems. Mammograms cannot prevent breast cancer, but we can find it when before it becomes a bigger issue. And when you find the cancer early, a lot of times it can be easier to treat, right? You don't have to go through the ordeal. And then also getting mammograms regularly is really the key to early detection, and regularly, just going one time, once every maybe 10 years, once every 5 years, is not going to be as effective as going once every 2 years or once every year. And your doctor might recommend, based on your risks, your doctor might recommend that you go even more often than that. So, and so who should be screened for breast cancer? Well, at this time, we recommend that all women ages 50 to 74 should get a mammogram every 2 years. If you are a woman who is 40 to 49 years old, you might want to talk with your doctor about getting a mammogram then. Before you get to age 50. Also, if you've had a family history of breast cancer, you might want to get screened earlier than that. If you've had any changes to your breast, any issues, or in your underarm as well, let your doctor know. You might want to get screened earlier than this. And so what our program covers, because again, we pay for breast cancer screenings for women that don't have insurance and can't afford breast cancer screening. So what we do is we pay for breast cancer screenings with mammograms for women 40 and older. So, and then also for men too, if a man comes to us and has a concern, we can also, and they're uninsured, we can help pay for that as well. So here, I think, are there any questions about breast cancer screenings? Because I'm going to move on to cervical cancer.
I'm curious if someone wanted to take advantage of the opportunity to have a mammogram paid for by your organization, would they be able to use the mammogram bus that comes around?
Oh yeah, definitely. And I think, don't they come to the library?
They do. They go to several libraries and other places too. I just saw the other day when I was driving into work, I crossed over the thruway and it was going under as I was going over. So it gets around.
Cool. I'll have to tell Margaret or Tanya, the woman on the bus, next time I see them.
Yeah. Tell Tanya. I know her.
Yeah, so we work with the mobile mammo coach. We work with around 200 providers in our 6-county area. So let's say you live out in Penn Yan. Well, we can pay for you to go, we can pay for the mammogram that you get done at Soldiers and Sailors Hospital that's in Penn Yan. Or if you live in Newark, we can pay for the breast cancer screening that you get done at Newark Wayne Community Hospital, or at Clifton Springs, or in the city, Borgonide. I don't work much in the city, so I won't pretend to know a lot of providers out there, but my colleague Jana Darlington does. So I like to say we can hook you up with your screening.
If anybody watching was interested in this, who do they reach out to?
I'll put my contact information at the end of this. They can reach out to me, or they can call our main number. It's 1-877. It'll be at the end of this, but it's 1-877-803-8070. So that they'll get a direct line into one of, I think, 6 of us on the team.
So there's no reason anybody should take any chances on their health. They can be covered.
Yes, they can. And, the sooner the better. So, okay. For cervical cancer, this we won't spend as much time on this one, but it's still important to talk about. So, and it's one of the screenings that we cover. It's something you should get done, when you need it done. So what cervical cancer is that it's cancer that starts with abnormal changes in the cells of the cervix. And cervical cancer typically grows pretty slowly over time. In most cases of cervical cancer actually begin as HPV or human papillomavirus infection. And HPV, it's a super common virus that's passed from one person to another person during sex. It's estimated that over 50% of the population has been exposed to HPV, and in most cases, our bodies will fight it off before, without even knowing it. It's if it persists and as we age, where it can become a problem if we still have that HPV infection. As I mentioned, so nearly all cervical cancer is caused by HPV. Over 90% of cervical cancer is caused by HPV. But in addition to HPV infection, there are a couple other factors that can increase your risk for cervical cancer. And of course, the first one is age. As we get older, our risk does increase for cervical cancer, as well as many other cancers. Also, not having a regular pap test. If you're due, you're due. So just not staying up to date with those pap tests. And then if you have an abnormal pap test result, if your doctor gives you a call and they say, cytology is, I need to see you in, I need to do some more testing, and you say, no, I already had it done, I don't want to do this again. By not following up with your provider, you are increasing your risk for cervical cancer. If you do get a pap test that comes back with something abnormal, that doesn't mean that you have cervical cancer or that you're going to have cervical cancer, but you should still follow up with your provider. And then also smoking. Smoking increases our risk for lung cancer. It increases our risk, for many, many cancers, as well as it increases our risk for heart disease, but it also increases our risk for cervical cancer. So it's important that if you do smoke, just don't tell me. There's a lot of resources out there that at the end of this presentation, if you're looking for resources to help you with stopping to smoke, I can help you out as well. So here's some more risk factors. So if you've been treated before for cervical cancer or for abnormal cells within the cervix that may become cancerous, that does increase your risk. If you've used birth control pills for 5 years or longer, for a duration of 5 years or longer, that increases your risk for cervical cancer. If you gave birth 3 or more times, or you have multiple sexual partners, if you've had HIV, or if you've had a mother who took, oh goodness, I can't say DES. I'm going to just say DES while pregnant with you. All of these things can increase your risk for cervical cancer. Now, if you go with your mom and ask her, did you take DES? Maybe she might not know, but if you have a mom, it doesn't hurt to ask. Or if you are a mother and you took this, it doesn't hurt to tell your kids. So what are some of the screening tests for cervical cancer? Well, we have the two big ones. We have the pap test, also known as the pap smear. And then we also have the high-risk HPV test. And what the pap test is doing, it's looking for any changes to the cells of the cervix. And that's when your doctor takes a little bit of the cells from your cervix and they send it to the lab. They look at it under a microscope and they look to see if there's anything abnormal. And this is just done during a routine pelvic exam. And if the pap test results show that something may not be normal, definitely just follow up with your healthcare provider. And then the high-risk HPV test, that's often done at the same time as like a routine pelvic exam. It's done pretty much in the same way. It's done the same way that a pap test is taken. And it's just what the high-risk HPV test is doing is it's looking for any changes. It's looking for, that's the pap test. It's what the high-risk HPV test does. It looks for the types of the virus, the types of the HPV virus that are known to cause most cases of cervical cancer. which is why that's the high risk HPV. And so a positive result from a high risk HPV test means that you should just be followed more closely and to make sure that these abnormal cells don't crop up, that they don't develop. So, and these screening tests, the cervical cancer screening tests, are so important because they can find changes within the cells called precancer that can then be treated. And that's how we can actually prevent cervical cancer from developing. Our cervical cancer rates have been on the decline since these tests became widely available. So that's a huge win for public health. And women's health, really. So who should be screened for cervical cancer? These are the recommendations. So starting at age 21, a woman should be getting a pap smear every 3 years. It used to be every year, I think, but we found out you don't need to go every year. You can do it every 3 years if you're 21 to 29. And then age 30, once you hit 30 and onward up to 65, you can do a pap test every 3 years. Or you can do a pap test and a high-risk HPV test every 5 years. Or, so you get options. Or you can just do the high-risk HPV test every 5 years. If you're younger than 21, it's not recommended for you to go get a cervical cancer screening. And if you're older than 65, talk with your healthcare provider about cervical cancer screenings. You may decide that it's something that you want to do, or you may decide that, it's just not, you haven't had it yet, you might not need, it might be decided that you don't need that screening anymore. So those are the recommendations. Pretty quick on cervical cancer. Any questions about cervical cancer screenings, anything like that?
Is it recommended that people get the HPV vaccination?
Yeah, so the HPV vaccine, it's recommended for kids really up to age 26 to get that HPV vaccine. It's a series of shots, kind of like the COVID vaccine. You can't just get one, but they have found that the younger the child, like age 12, it's recommended for ages 12. I believe starting age 12, they may have lowered the age. I think it's age 12 though, up to 26. And they found that when they're younger, that less, you can do it in 2 shots. As you get older, it might take the 3 shots. I've heard that you can get it up to age 40, but it just might not be effective. That's the thing. It just might not be effective. As we get older, our immune system, weakens a little bit. So it just may, by the time you're 40, it's not really recommended. So, but yeah, so the HPV vaccine can help to prevent cervical cancer as well. And there are actually a couple other cancers that are related to high-risk HPV. So it doesn't just, the HPV vaccine doesn't just prevent cervical cancer, it can prevent other cancers as well, ones that I don't talk about in this presentation. But when you feel like doing a little bit of reading, you can look that up. So it's not just cervical cancer.
So if you're young enough or you have kids, it's definitely a good one to consider.
Yes, and preferably before kids become sexually active. It's not, it's something that can help prevent your kid from getting cancer later in life. It's so important to protect them in any way that we can. So yes, but before your kid can decide whether they want a shot or not.
Yeah.
So get them while they're in the office.
Yeah.
Okay, so now colon cancer. So we talked about breast and cervical cancer. Those are the 2 ones that just affect women. So now this cancer, I'm going to spend probably the most time on this one. This is a cancer that affects both men and women. Colon cancer is sometimes called colorectal cancer. And so what it is, it's cancer that starts in the colon or in the rectum. That's that large intestine. When I speak with kids, I like to say it's your guts. In most cases, 80 to 90% of colon cancer does start as these non-cancerous growths called polyps. And this is just a little diagram we see of a polyp, two types of polyps. We have like a flat polyp, then we have a polyp on a stalk. That's kind of what it looks like. I mean, this is a very clean cross-section of of your colon. So this is just kind of an example of polyps. And so polyps usually take many years to become cancerous. So if you've ever had the colonoscopy, or you have friends that had the colonoscopy and they said, yeah, they found 2 polyps, they took them out. That doesn't mean that it was cancerous. That just means that they found polyps that could turn into cancer. And so their doctor may recommend it for them to get screened more often. So what are some of the risk factors? Well, common theme of today is getting older. So 9 out of 10 colon cancers do occur in people who are 50 years of age and older. So that's a big one. Also, having a personal or a family history of colon polyps, of colon cancer, or other bowel diseases, things like inflammatory bowel disease or Crohn's disease, can increase your risk for colon cancer as well. And then so those are things that you cannot control, right? We can't control getting older. Hopefully we do get older. But there are certain things that you really can control that do impact your risk for colon cancer. And these are listed in these little ovals here. The first one that in purple is your body weight. So body weight does matter when it comes to disease risk for colon cancer. If you're someone who has struggled with body weight, and you tend to be a little on the heavy side, that might increase your risk for colon cancer. So just be mindful of that. Also, consuming alcohol. Doesn't matter what kind. It could be red wine, right? It could be beer. It could be scotch. You know, it doesn't matter what type of alcohol. Consuming any alcohol regularly does increase your risk for colon cancer, as well as other cancers. It isn't just colon cancer, but that's what we're talking about. Also, not getting enough exercise. So physical activity is so important, not just for our physical health, but our mental health and our emotional health. You know, moving is good for us. It's recommended to try to get about 150 minutes, 2.5 hours a week of just moderate exercise. That could be, you know, really getting into cleaning the house or gardening. You know, it's the time of year for gardening, playing with the kids or with the dog, taking a walk, maybe going for a bike ride. These are all really doable activities, right? Just not getting enough exercise doesn't mean that you need to go out, get a gym membership and exercise. It just means that, you know, try to get moving more often, more regularly. Tobacco use. I mentioned with cervical cancer that smoking increases your risk for cervical cancer. It also increases your risk for colon cancer. So it's important, again, to try to refrain from tobacco use. And then this is a little bit of a wild card one, but consuming red and processed meats has been shown to increase your risk for colon cancer. And there's a caveat here. So consuming red meat, you can have research has shown that you can consume up to about 18 ounces of red meat a week and not increase your risk for colon cancer. Sorry, I have an itchy nose. It's if you consume over 18 ounces of red meat a week that your risk for colon cancer increases. And then with processed meats, a little bit of a different story with processed meats. Processed meats are things like deli meat, hot dog, bacon, let's see, corned beef. It's been a little while since St. Patrick's Day, but corned beef is a processed meat. And so consuming any amount of processed meats regularly does increase your risk for colon cancer, and it also increases your risk for stomach cancer. Why? I'm not quite sure, but we know that there is a correlation between these cancers and the consumption of processed meat as well as red meat. So that doesn't mean you have to give up your Sunday bacon habit or whatever it may be. I just want to give you this information. You do what you want with it. So as long as you get screened. So colon cancer screening test. So we have options when it comes to colon cancer. We have a lot of these take-home fecal tests. There's the, sorry for these acronyms here, there's the FOBT and the FIT test. So there's the fecal immunochemical test, and there's a fecal occult blood test. I think those are what those stand for. Those are just stool-based tests where you go to the bathroom, there's no prep required, right? You don't need to drink the Gatorade. You don't need to sound, it's okay. You don't need to spend a day, flushing it out. You can just go to the bathroom, take a sample, mail it in. And what they're going to look for with these take-home tests is any microscopic blood within your stool. And if there is blood in your stool, that could be, that could show that you might have a bleeding polyp. And then what they'll do is, if you do test positive for blood in your stool, you'll be referred for a colonoscopy. If it comes back with no blood, you wait 1 year and you do the test again. So it's not like every 5 or every 10 years. These take-home tests are every year, no prep required. If it comes back with blood in the stool, you then go get a colonoscopy. And so there's also sigmoidoscopies and colonoscopies. Those are also, I mentioned colonoscopy, that's where they look through the whole colon and they look for polyps, and then they'll remove them, and then they'll send them to see if they're cancerous. They'll send them to the lab to see if they're cancerous. Then there's also a sigmoidoscopy. And that's just where they look in just the lowest parts, the sigmoid part of the colon. And it's it's very similar to the colonoscopy. Same prep, same everything like that. It's just the lowest part of the large intestine. So here, I'm gonna go to, and these are just some examples of those take-home tests. So the bottom-ish right one that says ensure, those are the ones that the Cancer Services Program uses. And you just take the little paintbrush, after you go to the bathroom, you just kind of swish it around in the toilet and you dab a little spot on this, it's like a little paper sample area, slap a label on it, and you send it into the lab, and they'll let you know. Your doctor will typically let you know if there's blood in the stool. They get the report too. Everyone knows. Just your team. We also, on the top right here, we have what's called Cologuard. Oops. I'm gonna go back. I clicked on it by mistake. That's Cologuard. You may have seen a commercial for Cologuard. So that just might be something that you're more familiar with. It's a stool sample and a DNA test. And you don't have to do Cologuard every year. You can wait every 3 years to do it. And it's where you kind of put this little, oh goodness, it's a lot bigger in real life. The picture makes it look small, but you take a larger sample. You kind of send in the whole stool sample, right? You don't need to just take a little bit. They want the whole thing. And then they look for blood, and then in your stool as well as they do the DNA test. And then these are just some other examples as well of those take-home tests. So who should be screened for colon cancer? Well, all men and women ages 50 to 75. Men and women at a high risk might need to start getting screened earlier. And that means, let's say you are at an increased risk for colon cancer if, let's say, you had a dad who was diagnosed with colon cancer at the age of 40. You would actually want to start getting screened 10 years prior to his diagnosis. You would want to start getting screened at age 30. So that would make you high risk. You start getting your cancer screenings then. And let's see, yes. And then last but not least, colon cancer can be prevented. It's amazing when we actually can prevent a cancer. It can be prevented with regular screening, not just you get your colonoscopy one time and you say, that's it, I'm done with it. Or you do a take-home test 1 time or 2 times and you kind of give up on it, right? It's getting these done regularly when it's recommended by your doctor. And also just pay attention to your own bowel situation, right? Just be mindful of your own body. Assess yourself for risk, assess yourself for symptoms. If you feel like something's off, let your doctor know. About other ways to lower your risk do include drinking less alcohol. If you do drink, try to drink less of it. Getting regular exercise, staying a healthy weight, getting to and staying a healthy weight. I know it's easy to say, sometimes really difficult to do, but try your best. If you have a support team with you, so support a family member or friend, that can help as well. Eating healthfully, right? It's easy to say again, but try to get in our fruits and our veggies and our whole grains. Eat the rainbow is so outdated, but it's the best thing to do for our bodies, is to have a variety of fruits and vegetables in the right amounts. And then don't smoke. And if you do, it's never ever too late to quit. So this again is just quick spiel about our program, what we do. We again provide breast, cervical, and colon cancer screenings and any follow-up services, like if diagnostic services, at no cost for men and women who meet a certain age and income eligibility guidelines. And this is our contact information. Jana Darlington, she's my colleague. She's the manager of our outreach stuff. She's really great. And then there's me. So those are our emails. That's the number to call. If you have if you need a screening, if you know someone that needs a screening, if your husband needs a screening, we can help them out. Even if you are insured, if you just have questions about screenings, we can help as well. So, and then we have a website too that lists our services. And any other questions about colon cancer, about anything else?
I'm going to ask a quick question, and then I'm going to let the person that's also in attendance know that you're welcome to unmute yourself if you have a question, or you can write it in the chat box if you'd rather have me read it out. I don't mind. My question is, in case anybody out there has listened to this presentation and they're a smoker and they're like, wow, maybe I really should give it up. If they got in touch with either yourself or Jana, would you be able to direct them to maybe like how to cessation programs, or I don't know, whatever resources might be out there?
Yes, absolutely. So there's like the New York State Quit line, but at the U of R and at Wilmot, we have a lot of other programs that can help guide people, kind of coach them into reducing the amount that they smoke. And so they have groups that meet. There's like a texting there's a lot of different options that I can help connect people with. So, and a lot of people that just care, that just want to help, so yeah, we'll help out with that. So, well, I guess if Diane doesn't have anything, we're recording this, so I guess that would show up too, maybe on the on the video. Other than that, so again, if any questions, call that number or email me, even if you are insured, or if you're new to the area and you want to know where you can get screened, I can help you out with that too.
Well, thank you so much for this presentation. It's been great, very informative, lots of information and useful resources. So thank you.
Yeah, you're welcome, Stacy.
Yeah. Well, everybody have a great rest of your day. Thanks so much for tuning in. Bye.
Bye.